So that's
Yes.
so maybe.
So do you want me to unshare now while you talk, Purnima?
Yeah, because I have a few slides as well.
Okay.
Yeah, sorry. Thank you.
Yes, Dr. Purnima, I think we should start now.
All right.
Yeah.
Thank you, Masroor. Hello, everyone. On behalf of my colleagues at the Center for Chronic Disease Control and the Center for Environmental Health at the Public Health Foundation of India, I would like to extend a very warm welcome to all the participants in the first of our training and capacity building webinar series. I want to extend a particularly warm welcome to the members of the nursing community across India who are joining us probably for the first time here today. So welcome to everyone joining us this evening and morning. We have a few people joining from other zones as well. So I will start with just a little bit of context setting. And to introduce myself, I'm Purnima Prabhakaran, Deputy Director of the Center for Environmental Health at the Public Health Foundation of India. And to give a little bit of background to why we are doing this webinar here today. I lead the Center for Environmental Health, and we talk about the issues around environmental health in India. And while I was a physician and epidemiologist to start it, I have been a public health practitioner for the last 2 decades. And only in the last 6 or 7 years, I have started looking at the area of environmental health. And why? The reason for doing that is environmental health is that domain of public health, which kind of brings together everything in our lives, the macro environment, which means the natural environment, the air, the water, the soil, the built environment, but also how all of that relates to us as individuals at different levels of our microenvironment, which is at our individual level, at our household level, at the community level, how the quality of our macro environment relates to us as individuals and our health and our disease conditions. So environmental health has become a passion across several communities of public health practitioners, and rightly so. We are all seeing on a day-to-day basis now, not just in our country, but how the quality of air is deteriorating. We are seeing water-related issues. We are seeing exposure to lots of chemical toxins in different environments. And above all, there is a resounding voice around the issue of climate change. And I'm sure all of you are seeing this on a daily basis now. And in simple layman terms, for those who are probably not familiar, we're not going to have a climate science class over here. Maybe we'll park that discussion for another webinar. But today, in very simple terms, we talk about the weather. It's a sunny day, or it's a rainy day, it's a cloudy day. That is about the daily weather conditions, how the temperature, the rainfall, the precipitation is on a daily basis. Extend that to a longer period of time. That is when we're referring to the climate, the average weather conditions over a longer period of time. And we are talking about that changing in recent times. And climate change is changing. I mean, it's happening not for the better, but happening for the worse. It's worsening conditions around the world for extremely vulnerable populations around the world, and it's impacting our health and disease. And that's why we are coming together to talk about the issue of climate change with health sector professionals. And I'll share a little story at this point. 2 years ago, I think it was November 2019, I was at the COP25, which is the Conference of Parties, which is a global climate change conference. And I was there as part of the WHO delegation. And increasingly, I was hearing this conversation around, yes, we need the health sector voice to be raised against climate change. Doctors are very revered voices. We should encourage doctors to become advocates for environmental issues, for climate change. And more, I was hearing this sentence: above the doctors, there are the nurses. The nurses are more important than the doctors. And it struck me, and it stuck with me, that statement, and I was coming back via another conference that I was attending in Muscat on air pollution. And I don't know if it was serendipity, I was put in a car to go to the airport with the president of the International Council of Nurses. And there I struck another conversation with her. And here I was coming back to India thinking, now is the time for me to engage with the nurses in India. Why have I been only talking to the doctors or the public health students? I need to talk to the nurses as well. They are more important than the doctors when it comes to healthcare delivery. We all know that. Nurses have a big role to play. So even in the issue of climate change, I think the nurses have a very big role to play. And I only regret the fact that I took so long to reach out to the nurses in India, but I'm really happy that today we have the nursing community across India as our members of what you can see the icon here, the Health and Environment Leadership Platform, which is a platform of members from the health sector. And we missed you, we missed the nurses, and that's a big mistake on our part. And I'm really happy that we are better late than never, bringing you on board in this conversation today. So I'm going to start with a short introductory kind of conversation, and then get into introducing our guest speaker for today. Please give me a minute while I bring on the slides. Yeah, mine is a very brief presentation, but I want to do this to just set the context for all of you here today. So this webinar is going to be an introduction to climate change and health and perspectives for the nursing community. So why are we talking about climate change? So I already was talking to you about it is one of the biggest conversations that everybody is waking up to these mornings. Like, it is the biggest public health challenge of the 21st century. What you see here is pictures of the impacts of climate change. We see forest fires, we see melting of glaciers, And increasingly, we see air pollution from activities, human activities like this. We are burning fossil fuels for generating electricity. 70% of our electricity in India is generated by burning coal. And that is one of the major reasons for air quality deteriorating in many parts of our country. So climate change is considered as a big challenge, but it also gives us a big opportunity to act. And we hear about conversations around there is no planet B, we need to conserve our natural resources, and we need to raise our voice. And here is the voice of the health sector. This slide will capture for you in a nutshell what is happening as an impact of climate change on human health. So rising temperatures, more extreme weather events. As we speak, some parts of our country, Kerala, the Uttarakhand area, are facing flood events and the loss of lives and health. So extreme weather conditions like droughts, heat waves, floods, cyclones, storms, deteriorating air quality, polluted water bodies, all of these are causing impacts on health and exacerbating existing inequities in not just health, but also in access to healthcare. So we have extreme heat, we have degradation of living conditions. I'm not going to go through all of this, but just to show that the impacts of climate change are huge on our living conditions, but also on our health. And in the coming years, we are going to face increasing disease burden as a result of these climatic conditions changing over the years. There's going to be changes in vector ecology, for instance. Mosquito-borne diseases like malaria, dengue, encephalitis are increasingly being seen now in parts of India that had not been witness to it in the recent past. So really, the implications of climate change for India cannot be understated. We are pegged as one of the most vulnerable countries in the world to the impacts of climate change. And it strikes not just at the individual level, but also it strikes at the core of our health systems. We all work in healthcare facilities as health practitioners. So here are some scenes from parts of the world. This is Chennai floods in December 2015, where patients had to be carted out of the hospital because it was flooded. Similar scenes in Puerto Rico when there was Hurricane Maria in 2017. This is a similar scene from California because of the wildfires when patients had to be moved out. So really climate change affects populations both in developed as well as developing countries. So in 2015, there was a call in the COP Conference of Parties conference in 2015, what was the COP21, when there was a call for action for healthcare to align with what we know today as the Paris Agreement, where there was a call to mobilize health sector actors as climate leaders. And again, we were talking, I think, largely, at least in India, to the doctors and the public health community, but we were missing the voice of the nurses. So here is action pictures from around the world. This is from India when 2 years ago, there was a voice for action against climate change, saying the climate crisis is a health crisis. And how do we go about doing that? How do we raise the voice and how do we prepare ourselves to deal with climate change? We have help from all the different quarters. So this is a guidance document that the WHO put out last year in October, talking about 4 fundamental requirements for providing safe and quality care. And here is an important pillar. The first one they talk about is empowering the health workforce. And that means not just doctors, but also the nurses and all the allied professionals that come together to deliver healthcare. They need to be empowered. They need to know about climate change. And only then we can develop climate resilient and environmentally sustainable healthcare facilities. So we should know how to prepare to handle the increased disease burden, but we also need to know how to manage our water, sanitation, hygiene, our healthcare waste management, how we use energy when we deliver healthcare, but also how to optimize our use of infrastructure, technologies, and products. So basically, we are talking about healthcare facilities becoming structurally as well as functionally prepared to handle the disease burden that will come with climate change. And I just want to conclude by telling you a little bit of what's happening in India. So it's not that there has been no action in India. The Prime Minister's Council on Climate Change was released in 2008 June. But you will see that what they started off with is national missions for different sectors. And you will see that there is a missing conversation around health. It was only 7 years later that the government launched the National Health Mission. And today, within the health mission, the health ministry has taken action to support the health mission and develop a national program on climate change and human health. So if you haven't heard about it before, I hope that you will bear this in mind, that today, apart from national programs on communicable and non-communicable diseases, we have the Government of India's Ministry of Health hosting a national program on climate change and human health. And they are working with domain experts across the country in different institutes of repute to develop a framework for response to climate change across the health sector. And we at PHFI are one of the centers, and we are working with the government to develop the concept of climate smart healthcare. And I will just briefly take you through that. What we mean when we talk about climate smart healthcare is about preparing the health system. And when we talk about preparing the health system, this is also a little step that we are taking towards that. We need to empower the healthcare professionals, the nurses, the doctors, the public health students about the issue of climate change. Only awareness will lead to action. And if we don't prepare them in terms of what are the disease burden that is going to come with all the acute climate events, we can imagine what the health sector response will be. So awareness building, knowledge generation, sharing of knowledge around climate change is important. There is the other pillar of mitigation, which talks about reducing our carbon footprint. That's another conversation that we can have another day. But today it's basically about sharing knowledge around health sector response to climate change. And health facilities across India, from the primary health centers to private healthcare centers, are all taking action to become climate smart. And these are the pillars of action that we are talking about to the government at the national level, but also at the state level, about where we build our healthcare facilities and building infrastructure, how we use our natural resources, how we handle our healthcare waste, how we procure our goods and services in the healthcare sector. All of these are different pillars of action, but at the center of it all is human resources. And that's why we, as a big part of our capacity building, we talk to the doctors and the nurses and the different health actors. And to learn from best practice, it's my pleasure and privilege to introduce you today to our guest speaker, Professor Ruth McDermott. She has been a friend and colleague for the last 2-3 years when we have been working together around the issue of climate change and health. I will give you a brief introduction to Professor Ruth and then quickly hand over to her to share her experiences of working with nurses in the United States of America on the issue of climate change. Dr. Ruth is a professor at Villanova University's Louis Fitzpatrick College of Nursing. She's co-director of the Mid-Atlantic Center for Children's Health and Environment and has extensive community health nursing practice and teaching experience. But apart from being a clinical practitioner and teaching her students, Professor Ruth McDermott stands out as an environmental health leader. She was awarded the prestigious Charlotte Brody Award for Environmental Health Nursing Leadership and the 2020 Nursing Outlook Excellence in Nursing Practice Award for an article titled Ethical Principles and Guidelines of Global Health Nursing Practice. She has authored several publications. She has been an invited speaker in several global conferences on climate change, environmental health, has been in the COP meetings, raising the nurses' voice for climate change and environmental issues. We could not have had a better speaker to start this conversation with nursing community in India. So it's my privilege to hand over now and introduce you all to our guest speaker for today, Professor Ruth McDermott. Ruth, handing over to you. I will stop sharing my screen so that you could share your slides.
Thank you, Purnima. Let me just share my slides. Thank you so much for having me here today. As a nurse, I'm thrilled to be talking to nurses from India. And I'm going to share with you my journey in environmental health and specifically with climate change. Some of these things may not translate culturally. So, you know, as you listen to this, decide what works for you all in addressing this very important issue related to human health, which is climate change. So Purnima touched a little bit on why nurses, but a little bit of data. We make up 59% of all the healthcare professionals globally. There are 28 million healthcare professionals around the world, and of that, 19.3 million are professional nurses. So we are the bulk of caring around the world, and we have a specific education that can really mobilize and articulate the issues related to climate change and human health. So again, why nurses? We work very closely with patients, and as Dr. Purnima said, we are for the most part at the community and individual level, and so we see how people live, how it influences their health. We work across many sectors, both in the clinics and hospitals, but also out in the communities and schools. In the United States, we also have nurses in faith communities. So there could be a church nurse to reach out to people. We do see the link, as was described, of between how and where people live in their health. And we are the most trusted health profession. We have consistently been recognized for that. And the other thing that I think is so valuable for nurses is that we're able to translate complex concepts in a way for people to understand that. And so we have all these skills that really can help move this forward. I was glad to see there were photographs of healthcare professionals in India speaking out about climate change. We also do in the United States. And again, considering culturally how appropriate is that within India for speaking out related to alerting people that climate change is a health crisis. These photographs are from some of our national marches, and so everyone came out to alert the world or the United States about climate change being a health crisis. But there were a group of nurses, and these are my colleagues and myself that took the time to really be out there and say how important this is. There are organizations within the United States, but they also are international, that address climate change for nurses. The first one is Healthcare Without Harm, and I know Dr. Purnima has mentioned them. They actually were co-founded, their co-founder actually was Charlotte Brody, so she is a nurse. And she, the way this organization got founded was, she was alarmed by some of the things that were used in the healthcare setting were actually making people ill environmentally. One of the things was dioxin, and that was from burning chlorinated plastics. And in the United States, at one point, the way we dealt with our waste was by incineration, so burning it. And that has, because of Charlotte and her colleague forming this organization and speaking out, we now no longer burn our waste, which is really good because it was, again, as I said, it was making people sick. Another organization is the Alliance of Nurses for Healthy Environments. And this group you can join. I'm at the end of the slides, I have the web link for them. And there's a wealth of information, and also other nursing colleagues from around the world. It was founded in the US, but we have reached beyond that. We have nurses in Europe, we have nurses in Central and South America, and throughout North America. And so we would love to work with and collaborate with the nurses in India as well. And then another good resource for you all is the Global Consortium for Climate and Health Education. And there's on this website, there are a variety of materials for teaching in an academic setting, but they can be modified to use for nurses in service as well. So these are some of the things that the nurses from the Alliance of Nurses for Healthy Environments have done. In 2016, they met with, at that time, President Obama and had a White House roundtable to discuss the health impacts of climate change. As I said, and has been repeatedly said, nurses' voices are important, and our leaders want to hear from us. Other resources, and this is a collaboration again with the Alliance of Nurses for Healthy Environments and Eco-America and Climate for Health. They have the Nurses Caring for Climate and Health, and so here's the link, but I didn't want to show the video because I'm coming to you from the United States, and I thought there may be some issues, but this is a really powerful video that I would recommend that you watch about, again, nurses' role in climate change and what we can do. And also in the Alliance of Nurses for Healthy Environments, there's a climate and health toolkit. So there's information for you to move this forward. And this is all available to you. If you can get on the website, that's the only thing you need to do is use your computer and get on, and it's all available for free. We were very clear that this is really important, and we wanted to share this very broadly. And we also have collaborated with other nursing organizations to move climate change forward. And so I ask you to think about that and think about who can you partner with to have a greater voice. And because this is a new area for nurses, this can be challenging to move this forward. And so the more people you have working on this, the easier it will be to find your voice and to find voices within organizations as well. Excuse me. This is actually an organization from Australia, again, pointing out that this is a global initiative of nurses addressing this. And this is the Climate and Health Alliance. This organization is not just nurses, it's other health providers. So physicians, public health sector, and nursing addressing climate change within Australia and the health impacts. So the International Council of Nurses was mentioned, and ICN has a position statement on climate change that came out, I believe it was in 2018. But one of the things it says is it calls on national nurses associations to address climate change, to support actions to reduce global warming and address climate change and its impact on health. Raising awareness, as was just mentioned, of we need to understand what the issues are first. So we need to raise awareness with people for the health implications, and then assessing and addressing climate change risks and health. And so this is our international nursing organizations telling us that this is what we need to do. And so again, you know, there are many organizations working on this, and I highly recommend that you within your own organizations come up with what, you know, statements of how important this is, and then join with others. Also through Healthcare Without Harm, and this is an international movement, is the Nurses Climate Challenge. And so this is the Alliance of Nurses for Healthcare Environments and Healthcare Without Harm have come together, and they also have educational information on the website. The nice thing about this, for those of you who are in the hospital setting and the clinic setting, there is a lot of information about the link between our practice, taking care of patients, and climate change. And as Dr. Purnima mentioned, essentially greening healthcare, making sure that we are not adding to the burden of greenhouse gases and working to reduce the carbon footprint. So this is another resource for you all. And as I said, at the end, I will have information, the links for you for those. What we've also done is you need to understand what the problem is first. And so we have written articles about getting climate change into nursing curricula and into nursing practice. So here is an example of one of those articles. We've targeted at many different journals. So we've done education journals. This is the Journal of Nursing Scholarship. So this is actually an international journal. So we've targeted there. And then we've also targeted in sort of newsletters, newsletters to deans, newsletters to other nursing organizations. So again, we're reaching it at many different angles to get nurses on board with this. Just an aside, what I've found is when you start talking about this with nurses, as Dr. Purnima mentioned, most nurses are like, oh yeah, I see this. I see how heat is affecting my patients. I see how floods are affecting water quality and making people sick, or promoting vector-borne diseases. So nurses are ready for this. Adding to the resources, this is on the Alliance of Nurses for Healthy Environments. We created an online environmental health textbook. And this is the first edition. The second edition is due out very soon, hopefully by mid-November. And again, this is free. In the second edition, we do have nurses. This was mostly nurses from the United States. But in the second edition, we have nurses from Central and South America contributing. And hopefully in the third edition, we'll have nurses from India contributing. This is a great resource, but it's also a great way for nurses to get their messages out. And I encourage you to look at that. As you move into this space, it's important that you have a basic understanding of environmental health issues related to water quality, air quality, and how we live and how that influences the environment. And this resource will help you gain that. There's also this book called Project Drawdown that has taken very young researchers, which I love getting everyone in on this, and looked at the 100 most important things that people can do to influence climate change. And so the Project Drawdown resource has those 100 things listed. It's written very accessibly, and it uses the science to identify how we can influence reducing our greenhouse gases. It also can be used in your personal life and also your professional life. I use it quite a bit for teaching because I just find it very accessible. From that, then they developed what's known as the Nurses Drawdown, addressing specific actions nurses can take related to climate change. And again, I have that link for you. I hope you're hearing this, that we really do welcome collaboration and want to have a global movement. So, please reach out and address these very important issues. This is, again, showing that nurses around the world are addressing this. This is a nurse in Sweden that has nurses in Sweden and the UK. They've collaborated together and developed the Sustainable Nurse Network. And so they have, many of the things that we've talked about: recycling, reusing items, again, to reduce the carbon footprint within the healthcare sector. And I'm highlighting that nurses across the globe are working on this, and I look forward to what the Indian nurses can do. And this is also the different universities and regions that are addressing these issues with the sustainable nursing. This, as I said, is in Europe. The lead on this is Marie Elf, and she is a Swedish nurse and also has a background in architecture. So she is bringing her understanding of how buildings are created and communities are created into this space. This is, as I said, the Global Consortium for Climate and Health, and this is their webpage. And as I said, I'm giving you that link. So in sharing my journey, I'm going to share with you kind of my key points on how to get involved. And truly, we must do more. And many of you may be thinking, but how? You've had competing responsibilities. We only have so much time, but we recognize that this is very important. So the first thing is it's helpful to identify what is important to you. Because if it is, you can identify that, that can help move you forward in this work. And so why does climate change matter to me? And I have 3 pictures to support that. The first one is actually my family. I have 2 adult sons, and I worry about their future. I worry about what they're going to be in for with our changing climate and the challenges that are ahead of us. The next one is the woods and nature. I love being outside. I find nature restores me. Whenever I'm struggling with a question, I go to the woods and walk. And so I want to preserve that. I just think it's a treasure for all of us to share. And the last one, these are actually children in Madagascar. And every child around the world deserves an opportunity to grow and to thrive. And for me, I want to be part of assuring that globally. And so that's why it matters to me. And again, I ask you to think about why this matters to you. The next one is find your people. And I described that in working with the Alliance of Nurses for Healthy Environments. I always thought the environment was important. I could always see that relationship, especially in occupational health. And so I didn't really know how to move forward with it. And so I did find my people. Fortunately, when this was really percolating with me, this is the time when the Alliance of Nurses for Healthy Environments started forming. And so these are the organizations that I worked with early on and continue to work with my people. I found working through nursing organizations to be the most fruitful and gave me the support I needed to be able to identify where to target. I learned a lot about policy and how to engage. And so I found working with nursing organizations very helpful. The next one is say yes. So early on, people saw that I was interested in this and they asked me to do come to different meetings, actually testify with policymakers. And I said yes. I learned that in my graduate work. You got to jump in there. So that's what I did. But at the same time, I took the time to educate myself. So this is actually a photograph of a university in Philadelphia, where I'm from. And the first thing of saying yes, I went to a conference for climate change, environmental health and nursing in Philadelphia. They sent out this flyer, and this was in about 2006, maybe. They sent out a flyer saying, we're going to bring nurses together to talk about the environment. So my friend and I went. And I ended up talking to some of the leaders in the United States about climate change, environmental health and nursing. And what we sat on the floor in this hallway because there's no place to sit. And we talked about what we could do in addressing that. And what I decided to do for my region is I did an educational program for both nurse educators and nurse administrators, bringing them together. So it just takes a little spark. And I was able to get some funding through Healthcare Without Harm to do this. So I said yes, and I moved that forward. And by doing that, it connected me with a lot of other people with this interest. And it actually gave me some name recognition of people who were like, oh, we know what you're doing. And that actually was helpful because it opened doors. So, kind of baby steps in addressing this can help move you forward. So when you say yes, though, you need to make sure you take time to get prepared. And at that time, there was only one book on environmental health and nursing. Thank goodness it was only about 180 pages. And I spent a whole weekend reading it to be prepared and making sure that I could address things in an educated way. And so I gave you a couple of resources that can help you get prepared. But I'm sure there's also things in India and the Public Health Foundation of India also has some great resources to help you. So again, the textbook can help get people prepared. And now that you have found your people and that you are prepared, now you know something and you need to act. And as I said, I have testified, this is actually at in Harrisburg, it's the state, I'm from Pennsylvania, this is the state legislature, and I was testifying about, or this was a media event saying the link of the way we extract gas in Pennsylvania. We're a state that relies on fossil fuels economically. And I was saying that telling people that the health impacts of that are very important, and we need to address that as well. I also, again, thinking about targeting, is we've also used the newspaper and written, in the United States, we call this an op-ed, but we've written brief articles for the newspaper addressing environmental health issues. And this particular issue is directly related to climate change. Our natural gas, which is methane, is a potent greenhouse gas. And, you know, you're being asked then to put yourself out there and take some risks, that this is a new space for many of us. And so make sure you take time to celebrate the victories also, and the defeats. And so, you know, you will see things move forward, and you may work really hard and nothing happens. The defeats are just as valuable. You learn, maybe you need to reposition things and change your message. But also, I have found that even though things may not change, people have heard you. Especially being a nurse, that I've heard often, oh my goodness, the nurses are worried about this. Again, we are the most trusted profession. So, you know, be aware that although, you know, the change is slow, we're asking people to, you know, really change the way economies work, the way policies work. People do hear you, and it is very, very important that your voice is heard. And then the last, I think, just as important point is take time to reflect on that, and also take time to take care of yourself. For me, this has been additional work to what I already do. And so, and you know, I said I'm concerned about the future of my children. So my heart and soul is in this. And so you want to make sure that you know, take time to have some downtime. And again, make sure you take care of yourself, and, you know, whatever it is that you enjoy, that gives you joy, make sure you find that. Here are the resources that I've said, and I'm going to share these resources with Dr. Purnima so that she can send them out. I'll share the whole slide deck with her. And the model of find your people and get educated and you know, then act is actually, that's actually the route I took, but it's actually, I found policy models, frameworks for influencing policy in nursing education, in the nursing field. There are 2 frameworks that are available. I just didn't want to be, you know, too kind of scholarly, but I will share those articles as well if you find that they might be helpful. So thank you, and I would like to spend some time answering questions or hearing comments.
Thank you, Ruth, for walking us through your journey and your experiences as a nurse and practitioner in the United States. So I don't see any questions at this point yet in the chat or in the Q&A, but I would encourage the participants to please post your questions, or you can even unmute yourself, I think, and ask your questions. But meanwhile, maybe I can start with, thank you for sharing all those resources. I think there's a wealth of resources that you have shared with the audience here today. But if we were to kind of take it back to, at an individual level, what a nurse practitioner can do, to address the issue of climate change at their level? What would some of those actions be? I'm sure that's a question on many of our participants' minds. So what can I do at my at my level? So would you be able to kind of share something?
So I see that as kind of two different areas. One is in your personal life. And so, think about, how you use resources, think about how you use energy, and make those changes within your personal life. I've found that has stimulated conversations. And so people are like, why are you doing that? At my home, and again, India is very different than the United States, but, we reduce, we keep, it gets cold where I am. So we keep the temperature low so that we're not using as much energy. And, we just put on a sweater. My children complain when they come by that it's cold, but it's fine. It's fine. We also compost. So leftover food scraps, we compost and use that in the garden. So there's, kind of easy things. In the hospital and in the clinical setting, one of the first things that many nurses in the United States have done is address the waste that is happening at the bedside. So we have ready-made like trays, for the lack of a better word, of things for suctioning patients, for doing a urinary catheter, and all of those things have many things within that very sterile container that they don't get used. And nurses are at the bedside. We see how things are used. And so what many nurses have done is work, we call it procurement in the United States. They've worked with the people ordering the supplies to say, we don't need, certain items. So then they work with the manufacturer to say, reduce that. So that is reducing waste. Many of those things are plastic, single-use plastic, and they are made by oil, which is a fossil fuel. So you're really tackling a lot of things. And the nice thing about it is it has saved money for the institution. And so, it's a win-win. If you're reducing waste, that's great, but you're also saving money on supplies that are purchased and not used. And in the United States, and I'm sure it's the same for India, you have to pay to have waste hauled, taken away. That costs money. And so we have found by doing that, it is actually, they've measured the amount of waste and found that it has reduced what we call trash hauls, the number of trucks that are hauling trash away. So that's a great place to start.
I agree. I mean, I think the nurses have a great role to play over there, reduction at source of what we generate as healthcare waste. And I think that's very important, especially the plastics. I think that's all the more relevant issue nowadays in today's world, single-use plastics in particular. But can I maybe ask you, it may be a delicate question to answer, but what has been the strength or the approach of the nurses in the US? And how difficult or easy is it to raise your voice in decision-making processes at the health facility level?
At the health facility level, we have had actually a very strong voice. And it's from, this, I didn't have this in school. This has been a learning experience. So it's really looking at the various sectors across the health delivery system. So we need to start working with the administrators. We need to, as I said, work with the procurement people, work with, we call them facilities people who manage waste. And again, what I've found, because I worked on a project like that in our local hospital, what I've found is they're really happy to work with us because they're kind of, their expression is fine. Like the nurses are here, they get it. And so it has been very positive. And our health system is set up differently in that most things are paid for by insurance or private pay. And so we do have some government money that comes into our hospitals, but not like many areas of the world. And so anything the hospital can do to reduce the expenses, they're always very happy to hear that discussion. And that's really with the administrators, that's how we got them to listen of, wait a minute, this, it's an environmental issue, but it's also an economic issue. And so, yeah, we need to start thinking more in a systems approach.
Yeah, I mean, that's encouraging to hear, that yes, they do listen to the nurses' voices. And I think it's important, especially for the procurement decisions, because if you build the demand for sustainable procurement, they have to listen to you, because at the end of the day, you are the ones who are interacting and working with the patients. What are other pieces of advice that you would give? For example, in India, we have a very diverse healthcare system. We have the public health system and we have the private healthcare system. So procurement decisions, for example, may not necessarily be with one individual, or so what has been the practice in bringing together those decision makers? What has been the nurses' role in bringing together those decision makers on the right platform? Has there been a particular experience that you can share?
Well, yeah, because we are very different. We have kind of health systems that are more local. We have some that are large and cross many areas, but so it is easier for us to address it at a more local level, because many of the people that we talk to are also people that we kind of run into walking around the hospital. So we do have some familiarity. I think if you're looking at larger systems, again, working through nursing organizations, we have the operating room, or the operating theater, is the waste that's generated there, and rightfully so, right? We don't want to get patients infected. And then also thinking about the greenhouse gases that are created by anesthesia gases. So, we have an organization of operating room nurses, and so they can then work with their physician and surgeon colleagues, and then the hospital administrators to kind of address things on a larger scale. So if you want to move forward on a larger scale, I would definitely recommend working through organizations that you're in, because that gives a voice, and Healthcare Without Harm is one of them.
Yeah, true. I mean, we're aiming towards building those networks, where the doctors and the nurses start talking to each other. And yes, Healthcare Without Harm kind of has helped us host this platform. It is the India arm of the Global Green and Healthy Hospitals, this health and environment leadership platform. But moving to the other end of the spectrum, I was asking you questions about how nurses engage with the hospital administrators and the doctors. But what about at the other end of the spectrum, in your engagement with patients? Have nurses been successful? We are talking about the nurse's voice being more revered than the doctors. So how has that experience panned out for you?
Well, in the United States, and I'm finding this is actually around the world, but I could speak more to the United States. Climate change has been politicized, right? And so we've got people who tend to be more conservative that say it's not real, or this rising temperature and this is just a cycle. And then we have other people that say, no, it is real. So when talking with patients, I will, if we have an extreme weather event, we'd have like big hailstorms, we'd have winds that we've never had before, or flooding. I will say that's because of climate change. I just say it and just get it out there. And most people have been receptive to that. One of the places for nurses to get involved is discharge planning. When we send somebody home from the hospital, how do you prepare to go home? And so there's two things to think about: the extreme weather events that they're confronted with. And again, I will say, because of climate change, we need to be prepared for loss of energy because we get disruptions in energy or, emergency situations. And so I address that. But then also talking to patients about the waste that they, are generating from equipment, healthcare equipment or medical equipment that they make a home with, and talking to them about how can they safely reuse things is one way. And then, you've said climate change is our greatest health risk, but it's also our greatest opportunity. And so I also try to include, food choices that they eat. It's a more plant-based diet is healthier. So, kind of get that in. More active transportation, if you're able to walk places or bike places, is healthier. And so, that's a great thing to address climate change. And they're the things that we as nurses often do. Is you need to get more physical exercise, you need a healthier diet. And so they all link together.
Yeah, so basically you practice what you preach and get the word out there. So really interesting. Thanks. I don't see any questions. Is there anyone who would like to unmute in the audience and ask any question? Well, you have the opportunity, and we have Professor Ruth here with us. Any experiences can be shared, or any efforts here in India to kind of engage with either the doctors or your students or with your own health facility administrators or the government policymakers. Is there anyone who wants to share any experience? I think this is an opportunity for us to, just ask questions and share our thoughts. That's why we are here.
Dr. Purnima, participants won't be able to unmute themselves. They will have to
Oh,
raise their
right.
hand, and I'll have to give them speaking rights.
Okay, so there is at the bottom of the screen a raise hand option. So if anybody wants to speak, would you like to just indicate to us by clicking on that icon, and then we could take it from there. Or you could type a question in the Q&A. I can see the message from Dr. Prabir. Yes, we'll be sharing the presentation and the recording of the webinar, and we will be happy to know that TNAI is now a member of our network as well as ANEI. So the Student Nurses Association of India is within that fold as well. So we will be sharing it widely with our network. Chai, of course. Yeah, we'd be happy for you to help us disseminate as well all these resources. So is there anybody else in my team or anyone in the audience who wants to ask any questions? Yeah. So I see Megha in the audience. Megha, would you like to unmute? Mazroor, could you do that? Unmute Megha.
Yeah, just a second.
Yeah, Megha. So Ruth, I'm not sure if you've met Megha. Megha is from the Healthcare Without Harm team, but she's also with WHO and is the coordinator for the Healthcare Without Harm Sustainable Procurement and Health Project. So I see her in the audience, and
hi, Purnima and Dr.
yeah, I'm sure you would have something to say. Ruth mentioned a lot about procurement, so I was wondering if you had any comment or any thoughts to share.
On the way, I was just listening on the phone, but it was really interesting. It just glued me on. It kept me through the webinar, and really interesting findings that you have, Ruth. So I have been associated with Healthcare Without Harm for a while, and now specifically for the project on sustainable procurement, and working very closely with Purnima and team. And in our project, we have seen that how the healthcare professional, and especially nurses, can make the change. We have had these impact stories wherein just talking about PVC gloves and the latex gloves, how the nurses in India have had that move. Just the choice of the product, as you highlighted. They did say that, we do not want this product, and we were able to totally eliminate the PVC and latex glove in a couple of these healthcare facilities and move to nitrile. So I really see that, that movement moving on within the health facilities, the health network, especially Purnima and team have been really instrumental in having that movement within the country. So just highlighting on those key achievements that we've had, and we're working again very closely with the procurement teams in these hospitals and the nursing staff, and to especially on the chemicals that are used, the anesthetic gases that have been, utilized. So just telling, just re-emphasizing on what you said and how important you are as in the health systems to take this on. So really congratulate you on the work that you've been doing. Just I had a comment, Purnima, and no questions around that, but really incredible work.
Thank you. You mentioned COVID-19, and these awful shocks actually are opportunities also of how to do things. And who would have ever thought that we would reuse masks and things, but we've learned we can do it. So we need to think about, again, how we use things, and maybe, we don't need all these disposable things or disposing them after a single use. So yeah, thank you. And great to hear what you're doing in India.
Thank you, Megha, and thank you, Ruth. So if I don't see any hands raised, are there, Mazroor, can you tell me?
No, there are no hands raised.
Yeah, okay. So really, just to sum up over here, I just want to again record my appreciation and thank you, Ruth, for sharing all your experiences, your journey really. And let me tell the audience here that she's a passionate environmentalist at the cost of even being arrested for civil disobedience during her climate action. Yeah, you find a picture of Ruth in Google if you see arrested in front of the Capitol. I think it was 19, just before the previous COP, was it? Yeah. So that's the level of passion, that Ruth has for environmental health issues. So really delighted to have you here with us, Ruth, today. I think we've covered, just skim the surface over here, just to introduce to the audience here today about the importance of the issue of climate change and what a huge role the nursing community has in dealing with the issue. Whether that is at the individual level, Ruth shared with us some examples, little steps at the personal level, just as an exemplar of what you can do. You will be setting an example for your own family, but beyond that, at your healthcare facility where you are practicing on a day-to-day basis, little steps that you can take to, either address the waste generated at your facility, but also to build demand for sustainable products to be used in healthcare. Talk to your co-professionals, the doctors. The doctors sometimes need to be told, and it's not a bad thing. Sometimes you can do that. You can talk up to your doctors and tell them that they can change their practice. So nurses have a strong voice, so and we should use it. So whether it's talking to the doctors or it's talking to the people who are handling the procurement at your facility level, or the other practices across healthcare, there's a whole stream of upstream and downstream determinants that come into play when you deliver healthcare. Whether it's the transport, the procurement, the use of medical equipments, the use of personal protection devices, the food waste, the healthcare waste. There's so many things that are happening at every facility level. Besides, of course, preparing yourself, increasing your own knowledge about the disease burden that will be associated with the acute climatic events that are likely to happen at your region. Every region, especially in India, we always say it's a countries within a country. Every region has its own climate vulnerability. So understand for yourself what is the vulnerability in your region and equip yourself with that knowledge to deal with the health burden, the disease burden that will come with those acute climate events. We will be doing our part at our end. We will have, like we have promised to your the nursing networks that who have just joined our platform, that we will hold a separate webinar series, a teaching series, to bring you up to speed on climate change and its impacts on health. And I'm sure this will empower you as well in the coming months and years with the climate crisis, which is at the end of the day a health crisis. That has got to be our slogan. And not just stop there, not just stop with talking with your healthcare facility managers or the doctors or the administrators, but also with the patients. you can send your message across even to the patients. They will listen to you. And I think that's an important role that nurses play. And last but not the least, whenever you get the opportunity, raise your voice with the policymakers. Again, a very important role. You've seen examples of how Ruth did that with her friends in the nursing community in the US. So please, whenever you have an opportunity, raise your voice for appropriate and timely policy making in India as well. I think the more voices that come together, the better outcome for our country and its public health. So with that, I want to again thank you, Ruth. Thanks to you for taking the time out first thing in your morning. I'm conscious that you might have other commitments during the day today, but we look forward to interacting with you in the future as well and sharing your experiences with our nursing community and everybody else. I know there are some doctors here as well. And I'll close with saying thanks to my own team here for putting the event together, Mazroor and all the people who were working behind the scenes to make this happen. And I entreat the audience and particularly the nurses to please join us in the coming sessions as we impart more whatever little knowledge that we can share with you to make you better equipped to handle climate change. So with that, Ruth, any last words from you?
No, from a global perspective, as I said, we would love to collaborate and support one another. So, please reach out and we're happy to do that.
Yeah, sure. And we will share your presentation when you share it with me. I think there are a lot of asking for the many resources that you shared in your presentation. Yeah, thank you so much. You have a lovely day, and thank you everyone us here today.
Thank you.
Bye-bye.